you've been doing exactly what you were told. You rested, you put ice on your injury, you stretched, you went to the clinic and did your simple exercises with the light resistance band. But weeks or even months have passed and you are still in pain. I know how frustrating this feels, but there is something modern rehabilitation science has learned over the last decade. Many traditional approaches focus too much on protecting the injury and not enough on helping the body adapt. Today, we're going to look at 3 common mistakes that can slow recovery and, more importantly, what current evidence suggests you should do instead. Mistake number 1. Too much rest and too much reliance on ice. For decades, the standard advice for injuries was the RICE protocol: rest, ice, compression, and elevation. But modern rehabilitation has evolved. Current frameworks, such as Peace and Love, emphasize education, gradual movement, aggressive loading, rather than prolonged rest. Now, let's be clear. Ice is not ill. Ice can temporarily reduce pain and help someone tolerate movement during the early stages of an injury. However, there is limited evidence that icing improves long-term healing outcomes. Modern rehabilitation therefore views ice primarily as a symptom management tool rather than a treatment that accelerates recovery. Inflammation is a normal and necessary part of tissue healing. After an injury, the body increases blood flow and recruits repair cells to the damaged area to begin the recovery process. The bigger problem is that many people use ice as a substitute for rehabilitation. Pain management is important, but recovery ultimately depends on restoring the movement and gradually reloading the injured tissue. Instead of asking, "How can I stop all pain?" ask, "How can I safely keep moving?" That shift changes everything. Mistake number 2. Your rehabilitation never progresses. The second reason many people stay stuck is that the rehabilitation never progresses. Light exercises and resistance bands can be extremely valuable in the early stages of recovery. The problem occurs when rehabilitation stays there forever. Your muscles, tendons, ligaments, and bones adapt to the demands you place on them. If the challenge never increases, the adaptation never fully occurs. Think about it. If your goal is to return to running, jumping, lifting, or sports, your rehabilitation eventually needs to prepare you for those demands. Modern rehabilitation programs typically move through stages. Early on, the focus is symptom management, restoring movement. Later, the focus shifts towards strength, power, endurance, and function. In many cases, rehabilitation should eventually resemble strength training when clinically appropriate and tailored to the individual. The goal is not chase pain. The goal is to progressively challenge the body enough that it becomes stronger and resilient. Of course, rehabilitation is highly individual. Different injuries, medical conditions, and stages of recovery require different approaches. Which is why exercise progression should be guided by an appropriately qualified healthcare professional. Mistake number 3. Fear is limiting your recovery. The final reason many people struggle to recover is fear. After an injury, it is completely normal to become protected. Maybe you hurt your back. Maybe you injured your knee and now avoid squatting. Maybe you injured your shoulder and now avoid reaching overhead. In rehabilitation, this is often referred as kinesiophobia, the fear of movement. The problem is that persistent pain is complex. Pain can reflect tissue damage, but it is also influenced by many other factors, including nervous system sensitivity, stress, sleep quality, previous experiences, beliefs, and context. Especially in long-lasting conditions, the nervous system can become more sensitive. producing pain even after substantial tissue healing has occurred. When we avoid every movement that causes discomfort, we may unintentionally reinforce the idea that the body is fragile. Over time, this can lead to less activity, reduced strength, and even more pain. Modern pain science teaches us that the body is highly adaptable. Gradually exposing yourself to movements you fear within safe and appropriate limits can help rebuild confidence and restore function. The goal is not reckless movement. The goal is progressive exposure and confidence. The solution. So, what does modern rehabilitation look like? It focuses on active participation rather than passive dependence. It uses pain management strategies when needed, but does not rely on them. It restores movement, it progressively increases loading, and it helps people rebuild confidence in their bodies. Manual therapy, massage, taping, and other passive interventions may provide short-term symptom relief for some individuals, but current evidence suggests they are most effective when used to support an active rehabilitation program, rather than replace it. Recovery is rarely about finding the perfect treatment. Recovery is about consistently applying the right amount of movement, loading, and progression over time. Your body is not weak. Your body is adaptable. Give it the right stimulus, enough time, and a structured plan, and it can become remarkably resilient. All of the peer-reviewed studies discussed in this video are linked in the description below. Now see you in the next video.